I'm Kitty Poterack. I'm a pediatrician practicing here in Eureka, California.
And I'm Lois Freisleben Cook, also a pediatrician practicing here in Eureka, a developmental pediatrician with an interest in children with special health care needs.
Our subject today is child abuse, namely how we encounter it as pediatricians, how we try to help children, and how we try to help the community too in addressing the needs of children that are going through turmoil in their families.
And I think the biggest need, especially in the community, is for support that we can provide, that everybody can provide for those people who are responsible for responding to our reports of child abuse. The social workers, the justice system, the family services. It's really, really important that we have enough support for those folks that they can follow through once we identify a child who's being mistreated.
Yeah, exactly. It's an overwhelming problem if you break it down by numbers. And certainly it has to be dealt with on an individual basis in each case. But there are root causes that can be addressed that will minimize the burden eventually if we try to implement them. Most importantly, apart from the child who's being abused, is the importance of looking at the abuser and why someone would do this. Why would someone break one of the most fundamental contracts of a human being? The responsibility to protect and love your child. Why is that happening? And it isn't just a matter of black and white. There are root causes that need to be investigated and dealt with.
You know, we all assume that that based on the neurobiology of the brain as a child is born, that there will be a constant need and desire to protect the child, that there will be a behavior on the part of the parents that makes that child the most important person in the universe, that makes that child safe from harm. And when that doesn't happen, we have to look at why it doesn't happen.
Exactly. Why does a parent not have the ability to feel that protective instinct toward their child? And in fact, why does the parent go even beyond that and actually inflict harm on their child? What is a parent expressing when they are harming their child? And to assume that this is just a horrible person or a bad person who has no control over themselves won't solve the problem. Most cases of harm and pain inflicted are a reflection of inner pain that has built up.
A lot of abusers were abused, and so they've grown up with a sense that they grew up in a minefield with the same sort of PTSD, if I can use that canned phrase, the post-traumatic stress response that you see in, say, Vietnam veterans. It isn't unusual for somebody who's experienced combat to respond to the sound of popping popcorn with rage, or to respond to anything that feels on a subconscious level threatening with rage. And a lot of parents did grow up in that sort of environment where they felt that they had no safe place to be.
Exactly.
And then as soon as they're frustrated,
and they've learned responses. They've learned responses because of how their parents dealt with them. And subconsciously, they find themselves in the same situation that they were once in as a child. And this is the only way they know how to react to it. And also, they're re-experiencing that pain that they experienced as a child. And now they're lashing out. They're projecting it onto their child in the way it was projected onto them by their parents.
Yeah. Sometimes mental illness plays a role too, because children who grew up in a home of a mentally ill parent, for example, in the last few generations when mental illness wasn't really properly addressed. Okay, children who grew up in a home with a bipolar parent, for example, or a depressed parent, will have experienced trauma related to that, and may even have some genetic factors that are going to contribute to their parenting skills. And then as they grow up and they experience their own emotional and mental problems, they have no recourse but to lash out at whoever happens to be in the line of fire. for example, a person who has a bipolar disorder might have episodes where the amygdala fires kind of like a seizure firing, and they are busy all day, they seem fine, they seem okay, and then they get home and they shut down the rest of the brain, which is suppressing this little abnormal electrical activity. Then they start to feel uncomfortable, they start to feel a bad feeling, kind of like being in the middle of a Stephen King novel.
Simmering,
yeah, simmering, and they start to feel awful, and they start to wonder, why am I feeling this way? And they look around and they try to blame whoever's in the line of sight, because that must be who's causing this. Okay, and the next thing you know, they're trying to control that person, they're trying to influence their behavior, and then they go into a rage that they don't even remember.
What you do, what you model to your child, is what the child learns from and what imprints on a child's brain. And the other thing we know is that early childhood trauma affects brain development. All of a sudden, the sensory input to the brain changes the progression of brain development. And if it's not stopped, then this is a pattern. This is a hardwired pattern inside a child's brain. Conversely, trauma can be ameliorated by a good relationship with a caregiver. Stress can come from multiple avenues. One of the hardest is death within a family or divorce between parents. But a good relationship with a caregiver isn't, 100% fix, but it does help. It does help a child develop better ways of coping, better behaviors, and also more of a sense of security and mental stability.
I like to think of it as the hippocampal memory bank. There's a bank of memory in our brain in an area called the hippocampus, and that's where we store feeling memory. Feeling memory is the emotional response you have to a sensation. So, for example, you smell cookies and they smell like your grandmother's cookies, and you start to feel like you felt in your grandmother's house. That feeling memory bank fills up with these things. And the more it's reinforced, the stronger it becomes, and then those memories get stored in other parts of the brain. Hippocampal memory can be influenced, for example, when we see children and we have to do something painful. We have to do something traumatic, we have to draw blood, or we have to do a procedure that's going to hurt. What we try to do to ameliorate the negative hippocampal memory of that process, of that experience, is to flood them with lots of positive things afterwards. Bubbles, presents, coloring books, coloring pages, all kinds of positive reinforcement. And pretty soon the experience that child has in the aftermath of the traumatic experience has wiped out or knocked from place the negativity. And that kind of thing is important. It's exactly what Kitty's describing here, as that's exactly what happens when parents respond to trauma in a way that's nurturing, in a way that's positive, in a way that gives the child a really, really good feeling. It almost wipes out or negates the negative experience of the trauma.
And that's true. On a superficial level, somebody might say, okay, you're associating bad events with, superficial rewards, but you're not. You're actually telling the child, yes, sometimes bad things happen in life, but we can deal with them, and
you deserve to be made whole.
Exactly. You deserve to be made whole. Your feelings are acknowledged, and we reward you for being able to deal with them, and that strengthens someone's self-esteem. That's strength, and that gives them trust too. It gives them the idea that the world isn't out to hurt you. That there are people on your side, and life is full of some negative experiences, but you have the coping skills inside you, and we're going to help you develop the coping skills inside you to overcome them. What we're actually doing is creating the foundation for a human being to go on in life, and to give them the life skills to be independent, to help them cope with unhappy events and happy events, if we're doing our job right. And so, back to child abuse, we have to look at the person who did not learn this and figure out strategies, figure out mechanisms to help them become whole again, to teach them new ways of dealing with the pain that's inside them. And that will pay down the road too, because that will be passed on to their children and generations to come.
Yeah, many parents never did see how to be a parent, and one of the best ways to teach people how to do something is to model it. Another way is to reinforce the parent's sense of self-worth. Recognize that they have anger, recognize that they have anxiety, recognize that there are hundreds and hundreds of different colors to the tapestry of that person.
Yeah.
And then the bad ones and the good ones all have to come together, or you don't have a complete tapestry. And recognize that there are ways to show people the simplest things that we take for granted. We take for granted that, when a child is crying, you comfort them. Some parents don't know how to do that. They've never seen it happen. And so they say, oh, you just be tough. That's what they were told. You just be tough, just tough it up.
Or don't spoil the child.
Or suck it up, or whatever, and you can tough it out, right? Modeling is a very powerful tool, I think, and I think that most parents who hurt their children are people who want help, are people who want that sort of thing. I can remember times when, even as an adult, when I would become angry and frustrated and upset. And I remember in particular one person, a friend of mine when I was a fellow at CDC, he was from Colombia, and he was, just really a very kind and loving person, who would say, it's okay to be angry. It's okay. It's okay to have these feelings. It's okay to have the anxiety. It's okay to have the fear. People aren't often taught that. That was a very powerful message for me. That was extremely powerful. For the child, if we teach them just through the briefest little bit of a life raft that they matter, that they're important. A child who's growing up with a parent who felt like a piece of dirt on the bottom of somebody's shoe is going to feel that way himself. And all it takes is one person saying, you're important to me. You're important for me to listen to you. It's important for me to take the time to think about you. You matter to me. A child will hold on to that as a life raft. And even the most horrible environment will be transcended.
Yeah, no, and I see that in parents too all the time. Parents who are trying to put their lives back together, parents who have stumbled and now want to raise their child, and they come and they've almost got this apologetic sense of what they've done wrong in the past. And this feeling that has clearly been a blow to their self-esteem, and they don't expect to be taken seriously and to be nurtured themselves. And what I like to say is, past is past. This is an opportunity to create a new future. You've done hard work to get to this point. You're very brave to come to this point, to say that, I kind of messed up when it comes to raising my child. And we need to support them rather than look down on them or point the finger of blame at them. And that also will help the child, because when the parent is supported, the parent can support the child, and the parent can get positive feedback, positive reinforcement for the good parenting that they're doing now, and an understanding that, okay, it wasn't great, but the past is the past. It is not, you deal with it, but let's, focus on what is good right now between you and your child. And then the child will pick up on that too, because there is trauma. There is trauma when a child loses a parent because the parent can't function for whatever reason, and now the child is reunited with a parent. But like we said before, a good caregiver-child relationship ameliorates trauma in the brain.
Yeah. One thing I think that parents who are hurting their children and are themselves hurting don't appreciate is what they've done right. They look at everything, they do the plus, the minus, and they ignore the pluses, and they just continue to add up the minuses, and they don't realize how much they've done right and what their strengths are. the other thing is they don't realize that they deserve to be taken care of too, that they deserve to be spoiled. And one of the things that I think is important to tell a parent is that, you know, do something for yourself, because if you do something for yourself, it raises your child's self-esteem. When you start to value yourself, your child values himself more. He feels more important. And you don't need to be a martyr. Nobody wants to be raised by a martyr.
Oh, exactly. Yeah. No, exactly.
Yeah.
You know, that's putting on a child responsibility for your happiness, and that is not a child's responsibility.
Yeah.
You know, it's like we said, it changes the course of things. It does. You can take a U-turn in your life and make things better, and we should support that too as a society. I think as a culture we have this tendency to finger point, to blame, and where does that get us? That
Nowhere.
literally gets us nowhere.
Nowhere.
You know, it doesn't make up for what happened to a child. It doesn't take care of a child. It doesn't take care of a parent who's trying, you know, their darndest to get the skills and to overcome the past. And let's not forget, most of the parents that do that were once the child. They were the ones that were harmed. And that pain was in there simmering and subconsciously recognized the same situation and then lashed out with the patterns that were learned.
Like learning to play the piano. Anything that you do, the more you do it, the more it becomes a hardwired action. Okay, that's the same for patterns of thinking and patterns of reacting to things. Okay, that's why, for example, that cognitive behavioral therapy works well. It teaches you to think about something differently and to practice thinking about it differently and to practice reacting to it differently. And that's where modeling helps. Modeling helps a parent to take a situation and look at it from a different lens, see it in a different perspective, take it and rethink it and reanalyze it and re-respond to it. And those pathways can still develop in a parent. We are not hardwired by the age of 5 as we used to think. We are still infinitely flexible in our ability to change our ways of thinking, our ways of seeing ourselves, and our ways of responding to our children. And an effort put into that will make a huge difference in the repeated nature of child abuse.
In some ways, child abuse is a form of terrorism. And when we're dealing with terrorism, if we are just focused on preventing one act at a time, you know, then we're missing all the other opportunities where, you know, can create disaster. But if we focus on what is generating this terrorism, if we can help that, then we don't have to have this hyper-vigilant approach of one case after another. And we won't, you know, have this feeling that we are being overwhelmed by numbers of individual cases of abuse, of, you know, families that have fallen apart. Of course that's overwhelming. Of course you can feel pessimistic if, you know, you look at it as this blanket whole. And it's not to say we shouldn't deal, you know, with what's going on, but we're going to have the same problem exponentially multiplied if we don't look at the root causes, if we don't support people in trying to parent, if we don't look at the things that are creating pain and isolation in people in our life. That's where our efforts and our resources should be spent.
And that's where the social workers come in. We do not have, as a community, we don't have as great an appreciation of their role. We don't understand, most people do not understand the power of the simple little things that a social worker can do. A good social worker, a good social work therapist, given the time and given the resources, can make major changes in the life of a parent and a child, and yet instead the social worker is left with mounds of cases, mounds of paperwork, piles of meaningless work, and the frustration of not being able to interact one-on-one or one-on-two with these parents and accomplish the kind of change that they're trained to accomplish. Social workers need to be more plentiful, they need to be more supported, they need to be more respected, and their opinions need to be taken into consideration with far more weight than they currently are by the justice system, for example. They need to be listened to, they need to be seen as the experts in this area. We are experts in medicine, we can identify the signs and symptoms of a child who's being abused, but the true experts are the people who go into social work and who do that because they love the potential that they have for intervening and changing a life and changing a community.
The social paradigm of what a social worker's role is should be changed. It isn't us utilizing someone to get control of a problem that we want to sweep under the rug. You know, of seeing, oh, this is just so horrible, these kids are abused, they're in a terrible situation, here you go, make it better, and just get it out of my way. That's the wrong attitude. And unfortunately, even the most positive person can sometimes get overwhelmed with that sense that suddenly they are loaded with the responsibility of making it better. Band-aid on here, make it better, get it out of our way so we can go on to the next case.
Ideally, the way I envision it is that the social worker is a conductor of an orchestra of resources. She has mental health services, she has legal services, she has medical services available to her to evaluate, provide her with the input that she needs. Men are very good social workers too. And then that person can determine what's the next step. What do we need to do in this situation? What more information do I need? And then can work with the family. It doesn't require a clinical psychologist or a psychiatrist to do this. It requires someone who has the training that all social workers have to be able to intervene. And all they need is access to the information that will allow them to do that, control over these resources, being able to say, I want you to see this person and I want you to come back and answer these questions for me. I want you as a medical provider to answer these questions. I want to be able to tell the legal system what to do. And I want time with this individual. I want time to intervene in the way that I know I can be effective. That's a whole paradigm shift, but it really is where the power should be. It is.
Yeah, I agree. And our resources too. We really need to look at how we're spending our resources. Again, we're so focused on punishment, especially like with individual drug crimes, and and drugs do play a big role in child abuse and in the disruption of families. Instead of looking at, okay, why does someone choose to do this? Why is there self-harm? Why are they choosing to escape? And why is it so prevalent in our culture? And we need to look at outcomes too. What have we gotten after decades of spending trillions of dollars on a drug war, on trying to put band-aids on pulling kids into foster care? What have we accomplished? We haven't accomplished much. So if we're going to be logical about this, we need to reinvent the paradigm. We need to say, maybe positive reinforcement is a better way to deal with human beings. Negative reinforcement only gets you so far. Negative reinforcement, if anything, pushes things into the closet, makes people hide away. Rather, let's say, let's take these resources and spend them on things that might improve or ameliorate the trauma that's happened in early life. Better mental health care, better access to health care, period. Letting people understand that punishment is not the goal when they mess up. The goal is to help them fix what's broken inside so they can become a whole human being again, so their children can grow up with a whole human being, so the problem doesn't just keep going down generation after generation after generation. If we're going to be honest with ourselves, what we got right now is not working. It's simply not working. And the evidence is right there before us in the numbers that we see. And
in the economic consequences
exactly.
of what we see, and in the futility of the economy of the process that we have now. It's totally futile. There are models in other countries. There are models, for example, in Sweden. and in Germany about ways in which things can be done better. Those models could be explored, and utilization of them could be considered here, and they are far more economically thrifty, if you will, and more effective. And the kinds of countries I'm talking about are the kinds of countries where somebody who is involved in providing social services is highly respected. They're the countries where teachers are highly respected, where the role of an individual is given the weight it deserves for what they're doing, and not put on an artificial system of stratification that doesn't have anything to do with reality.
Yeah, I think a lot of what we do and a lot of what we spend our resources on, again, as I said, is in punishment. And it translates down to our culture, which is a culture of finger pointing and making a person feel worthless, which then drives them into more of the same behavior that started them on this road. And it doesn't help any of us. It doesn't help. Yes, if shame could make everyone behave according, to what we want them to behave as, well, I think we'd have seen the results by now. There's a lot of shame to go. Shame is pointless. Shame doesn't teach anyone. It doesn't make anyone want to come forth and learn new ways. It doesn't help children. It doesn't help our culture. It accomplishes culture. We need to rethink things, and we're going to reap the benefits down the road. Predicting it's going to be much more cost effective than what we've got going.
Of the children that I see or that I have referred to Child Protective Services over the years, maybe one family in 10 truly needs to have those children removed from an environment that's not going to be amenable to rehabilitation. The rest, if we could again empower the people who are in the position to do this, can be rehabilitated with the simplest and most loving and the kindest of methods that don't cost as much as what we're doing.
And it's something we need to fix. We have an overwhelmed foster care system, and foster care is a good thing, but it can only go so far. I do want to carve out a separate section of child abuse, which is child sexual abuse, that we're not going to address right now. Those are different issues, and I don't want them mixed up with this. But what we are talking about is a pattern of behavior and internal harm that needs an outlet for rage, and that there are better ways of helping with that, better ways of dealing that will help both parents, children, and the community.